Welcome back. The Senate hoping to get a vote to repeal Obamacare to the floor this week, possibly Tuesday, Wednesday. There are two options on the table. The first is an outright repeal of Obamacare. The other is a revised version of the Senate's repeal and replace plan, which, of course, did not get enough votes in the last attempt to bring it to the floor. Joining us right now is Kentucky Republican Rand Paul, a member of the Senate Health Committee. And it is good to see you, Senator. Thanks so much for joining us.
Good morning.
Well, you were a no in that last plan. Will you vote for a clean repeal this week?
Well, I think that's a real question. What are we going to be voting on? Last week we were told it would be the 2015 bill, which is a clean repeal. It's still a partial repeal. I wish we could repeal the whole thing, but they're going to present us with either a partial repeal or the Senate Republican leadership plan, which I think does not repeal Obamacare, but really is a pork fest full of all kinds of government programs and government spending. In fact, I think it's become the kitchen sink. They're throwing money in for anybody they think they can buy off to get on the bill. But what I'm pushing for and what I've told them is I will vote to go to the bill, meaning to begin the debate on Obamacare. I will go to that if they promise that the first vote will be a clean repeal, because that's what we promised the American people.
But what happens then, Senator? I mean, let's say you all vote for a repeal, you repeal it, and then there's this transition period. What happens to those people who are relying on Obamacare?
Well, one of the things that I've been proposing that I think could help not only those on Obamacare, but there's also 27 million people on Obamacare that don't have any insurance. Most of those people, or about half, they say, don't get the insurance because it's too expensive. They don't have the money to get it. So if you let people join associations, I think you can dramatically bring down the prices. There was a story out just the other day on what is going on with China with drug prices and using the leverage of large groups to buy drugs. You can get extraordinary savings. And I think we can get extraordinary savings in health insurance if we let people band together, so you don't have to buy it mom and pop by yourself. You join a big association to get your insurance. That is one way I think we could help people get insurance in that interim period and really ongoing.
Is there something, is this the kind of arrangement that could create a change or a new amendment to the old bill that you were no to? I mean, I'm just trying to understand if there's anything that can happen, that can change from the old bill. And I understand what you're saying. I mean, the taxes are still in there. The subsidies are still in there. It does look like Obamacare light. But is there something that can be changed that would get you to a yes? For example, your colleague Ted Cruz, he was a no, but he comes up with his own amendment to make it a little more competitive for the states. And then he turns to a yes. Here's what Ted Cruz told me this Friday. I want to get your take on it. Listen to this.
And what it says is that you, the consumer, should have the right to choose what health care you want to buy. If you want to buy a plan with all the federal mandates from Obamacare, you should be able to buy that. Those plans will still be on the market. But if you want to buy a different plan, if you want to buy a plan that doesn't have all those mandates, that's a lot less expensive, you should have the freedom to make that choice for you and your family. HHS this weekend did a study, analyzed the Consumer Freedom Amendment, and the results are incredible. They projected that with the Consumer Freedom Amendment, 2.2 million more people will get health insurance than have right now. You know, the Democrats always attack Republicans. Gosh, getting rid of Obamacare reduces insurance. Well, the Consumer Freedom Amendment expands coverage, and the most critical piece is it lowers premiums.
Can this amendment bridge the gap, the split between the Republicans right now?
I believe so. I think it's the key to bringing together everyone is that, look, if premiums go down, and don't just go down a little, go down a lot, that's a big win. It's a big win for conservatives, but it's a big win for moderates. It's a big win for everyone in the party because it's a win for our constituents.
What about that, Senator?
I've always been a big fan of giving people the freedom to buy whatever kind of insurance, including inexpensive insurance. So I've been supportive of the amendment. However, what I don't like about the process is those who put forward the amendment also agreed that CBO would say it costs a lot of money because what's going to happen is adverse selection will continue in those Obamacare plans. And so basically they're getting freedom, but they're having to pay for it with an enormous insurance stabilization fund, which I call the insurance bailout super fund, and I'm not really for that. I'm not for the government giving any private industry taxpayer money. So Cruz has been willing to accept his amendment, but he's willing to accept a much greater government subsidy and involvement in insurance, and that I'm just not for. I've told them that the one thing that could get me to yes is if you take that insurance bailout super fund and put put it somewhere else. Take it off of this bill, because I just philosophically, it hurts me deep inside to think of giving a corporation that has doubled their profit under Obamacare to double their profit again at the backs of the taxpayer. I'm just not for that. That's not capitalism. That's not free markets. It's not conservative, and it's really just not even a Republican idea.
Yeah, look, and that's why throughout this whole campaign of repealing and replacing, I have followed your thinking very closely, and I thought you were going to make this bill even better, because you were pushing and pushing and pushing to make sure that this was a plan that was not big government, didn't include taxes, didn't include all of these subsidies. But here we are. We're at the end of the line, Senator. I mean, if you continue to push back, it's going to affect the rest of the agenda. You know that, because you wanted to do health care before you did tax reform. So are you ready to sit there and say, yeah, I'm not going to vote yes for that first plan, and it is going to be my legacy that I allowed Obamacare to continue to function, or dysfunction?
You know, I guess the real question, and this is a big question, are we better off sort of voting for Obamacare light, and a year from now premiums are still going up, we still have the death spiral of Obamacare, and now it's blamed on Republicans? Or are we better off actually passing nothing if we're going to pass Obamacare light? And actually nothing would still realize that the blame would still go on those who created this disaster. That is the Democrats. They created Obamacare. Now, I'm not advocating nothing. I want to move forward. One of the big things I want is letting people join these associations, but it looks like we're still not certain whether that's going to remain in the bill. There's a little bit of it in the bill, but they haven't been willing to negotiate with me to make it better. They've got a little tiny association plan, and the parliamentarian's going to decide this weekend whether it stays in the bill or not. An unelected person who is hired by the Senate is going to decide what is in the bill and what's not in the bill, and I think that's crazy.
And you're good with that, even if the Democrats get the majority in next year's elections? You're still good with your decision today?
Yeah, I think that we're more likely to get Democrats in charge and lose politically if we pass something that doesn't work. I don't think the current construct of this bill will work. I think it keeps the fundamental flaw of Obamacare. The death spiral will continue, and we're going to subsidize it. So here's what next election looks like. There's less money from the government going to poor people, but there's more money from the government going to rich people who run insurance companies. I think when voters find out that Republicans gave billions of dollars to rich insurance companies and took money away from poor people getting Medicaid, I think that's a disaster. So they need to think this thing through, because I think just pass it is not a great strategy, particularly when you wind up with something that looks like poor people got less health care and rich people got more of your money.
Real quick, Senator, before you go, let's say this fails. There's no vote next week. Do you advocate just cutting taxes, or forget tax reform as well? Forget the whole agenda?
No,
I think it's
actually,
a fair question to ask if Senate Republicans actually want this president to succeed at this point. Got to ask the question. Do you want this president to succeed?
No. Yeah, absolutely. And I think we can move on to tax cuts. But to tell you the truth, I think clean repeal could even be married with the Senate leadership plan. And as long as you took the pork off, I think conservatives would be interested in voting for it. And if the moderates want a pork fest, let's stick their big government spending on another bill. And they can probably get that in by working with Democrats. And then it's more honest that conservative Republicans could vote for something that looks more like a repeal and helps the situation. And we don't have to be forced to swallow a big pork fest that they're sticking on there. But yes, absolutely, I'm for the president's agenda on repealing Obamacare and reducing taxes.
All right, we will leave it there. A lot on the agenda, sir. Great analysis. Thanks so much for joining us this morning.
Thank you.
We'll see you soon, sir. Senator Rand Paul. And just ahead, more on the shakeup in the press office at the White House. Former White House Deputy Chief of Staff Karl Rove will join me as we look ahead. We know Sean Spicer is out. What about Reince Priebus? We'll get into it next. Sunday Morning Futures right here.